I'm Steph Smith and I'm a clinical academic, so basically what that means is I work across the NHS and the academic setting, trying to bridge the gap in between research and clinical practice. So I'm working on a few projects with the Trust at the moment. So one of them is the Lean programme. So that is the Lifestyle, Energy, Activity and Nutrition programme. It's essentially a lifestyle programme specifically for people with learning disabilities, because we know that kind of standard lifestyle and weight management programmes tend to not work very well for people with learning disabilities. So there's a real need for a more bespoke offer, if you like. So we have some funded research at the moment, which basically brings together academics like myself, clinicians, voluntary and community sector organisations like the Trust, and community members as well, so people with learning disabilities. And we're all working together to identify how we can modernise Lean and make sure that it's still fit for purpose and ultimately helps people with learning disabilities to lead healthier lives. So we have people from the Trust as co-researchers, so we have community members part of the research team, which is super important. So the same way in clinical practice we want to do with, not to, the same applies for research, so we want to do research with, not to. There's a real need to improve the eating environment and the kind of systems level support for people with learning disabilities and mental health conditions. So actually being able to work with communities such as Camphill Village Trust helps us kind of implement those changes at a more population-based level rather than waiting until someone gets sick and then giving that support. So there's a real need to kind of move dietetic intervention more upstream into that prevention space and population-based intervention space, rather than waiting until someone gets poorly and then struggles to access a service that's going to help them. So yeah, we want to try and kind of bring dietetic intervention out into communities.